What if I told you that one of the most powerful tools in all of modern medicine isn't some high-tech scanner or a fancy new drug? What if I told you it's something every single healthcare worker already has? A tool that can literally save lives, and it's right at the end of your own two arms.
We think of hospitals and clinics as these incredible places of healing, right? But there's a flip side we have to talk about. The very places designed to make us better are also, by their nature, places where risks are concentrated. They can become hotspots for what we call healthcare-associated infections, or HCAIs.
So, how do these dangerous microorganisms get around? What's the main way they travel from one spot, or more importantly, one person, to another? You might think it's the air, or maybe some piece of equipment.
But the answer, honestly, is almost shockingly simple. The number one culprit, the primary cause for the spread of these infections, is our own hands. It is the single most common way germs are transmitted in a healthcare setting.
That makes this whole thing a mostly invisible threat, which is exactly why we need a super clear, systematic way to fight it. So, before we get to the solution, let's just take a second to understand the scale of what we're up against.
This chart really helps make that invisible threat visible. Now, according to the World Health Organization, in the US, urinary tract infections are the biggest slice of the pie at 36%. But look over here, bloodstream infections and pneumonia, each at 11%. Those can be incredibly serious, even life-threatening. So this isn't some minor problem. This is a huge, system-wide challenge.
Okay, so how in the world do we fight an invisible threat that's everywhere? Well, the World Health Organization came up with this brilliant, simple, and powerful strategy. And it's not just about washing your hands more often. It's about doing it at 5 very specific, very critical moments. Let's break it down. So first, we got to understand this key idea, the patient zone. Just think of it like a protective bubble around the patient. It includes their skin, their bed, the bedside table, the equipment connected to them. This whole area has the patient's own normal germs. And the goal is simple: stop harmful germs from getting into that zone and stop any germs from getting out of it and spreading. And boom, here it is, the 5 moments for hand hygiene. The logic is so beautifully simple. Look, you've got 2 moments that happen before you do something and 3 that happen after. You clean your hands before you touch a patient. That's to protect them. You do it again before any kind of clean procedure. Then you clean them after any risk of fluid exposure, after you touch the patient, and after you touch anything in their surroundings. Every single step is a barrier, protecting the patient, protecting you, and protecting the next patient. It's just a brilliant, life-saving checklist. Now here's the thing. This amazing system only works if it's dead simple to follow. And that means the tools, the soap, the sanitizer, have to be right there at the point of care. We're talking about a sink or, way more often, an alcohol rub dispenser like you see here being immediately available. No walking down the hall, no excuses. It has to be right where the care happens. Okay, so knowing when to clean your hands is half the battle. But the other half, and it's just as important, is knowing how. Let's start with the classic method everyone knows, good old soap and water.
So this is a really common question. Should I wash with soap and water or use an alcohol rub? Well, the rule is actually crystal clear. You use soap and water whenever your hands are visibly dirty or soiled. Makes sense, right? But for all 5 of those other moments we just talked about, the go-to preferred method is an alcohol-based hand rub. Why? Simple. It's faster, it's actually more effective against most germs, and it's usually less irritating to your skin.
All right, let's get into the technique. Now, this seems basic, but every little detail matters for getting full coverage. So after you wet your hands and get enough soap, you start by rubbing palm to palm. That gets a nice lather going. Then you clean the back of each hand, interlacing your fingers to really get in between. Then back to palm with fingers interlaced again.
And here are the steps that people almost always miss. Cleaning the backs of your fingers, getting each thumb with a rotational rub, and then cleaning your fingertips on your opposite palm. Those are the parts that touch everything. Then you rinse well, dry your hands completely with a single-use towel, and, this is huge, use that same towel to turn off the faucet. Otherwise, you just put germs right back on your clean hands. Now, let's cover the method that has completely changed the game for hand hygiene. This is now really the gold standard in most healthcare settings, the alcohol-based hand rub.
So what's great here is that the technique uses the exact same motions as hand washing. You're still going palm to palm, backs of hands, between the fingers, and you're still giving special attention to your thumbs and your fingertips. But here's the key difference. No water, no towel. You just keep rubbing until the alcohol has completely evaporated. As soon as your hands are dry, they're safe. It's that fast.
So after all that, after learning the when and the how, what's the end result? Well, it's actually a very simple but incredibly profound outcome.
That's it. By following these evidence-based steps at exactly the right moment, you break the chain of transmission. Your hands are no longer a potential vehicle for infection. Instead, they become what they were always meant to be, a tool for healing and for safety. It's a really powerful result from such a simple action. And you know, that really brings us to the final thought here. We have the knowledge, we have the tools, we know for a fact that this simple act saves lives. So the real question isn't about the science anymore, it's about human behavior. Why, in the middle of a chaotic hospital shift with a million things to do, does this one fundamental practice remain one of the single biggest challenges in patient safety? That's really something to think about.